morning. My name is Susan, and I'll be your nurse today. This is what a patient should hear when a healthcare worker enters their room. Unfortunately, that often is not the case. What they get is someone rushing in and out of the room, no introduction, no smile, no eye contact. Think about how that would make you feel. You're already in the hospital, maybe in pain, nauseated, maybe scared and worried about a surgical or some other kind of procedure. There may still be restrictions due to COVID, so you may be alone. And the person or people supposed to be caring for you are treating you like a bother or a burden. The first step in any process is to find out what the problem is. The culture of negativity demonstrated by the nurse leader when speaking to staff and the team's negative nonverbal and verbal communication toward patients results in lower patient satisfaction scores on the acute inpatient rehabilitation unit. The patient satisfaction scores for the months of August, September, October, and November were between 55 and 58%, except for October of this year, which was 50%. Our goal is 74%. This is concrete data that I've collected. However, I also interviewed a total of 20 patients, asking them three simple questions. Number one, do staff speak courteously at all times? Number two, how is the nonverbal communication? Again, do they smile, make eye contact, etc.? And lastly, do you feel like the staff genuinely listens to you? Out of the 20 patients, not a single one could answer yes to all three questions. As a matter of fact, the answer was usually no to all three. Given the limited size of participants, I was not able to determine if the communication was better or worse on either the day or the night shift. Why is that? Is the nurse having a bad day? That's not an excuse. Is the floor understaffed? Again, no reason to behave in that manner. I believe that this happens because nurses, aides, and healthcare workers in general have not been taught customer service focused communication. Do most of us even look at our patients as customers? Because that's what they are. They have a choice where to buy their healthcare from, and we always want them to choose us. In order to address this lack of customer service focused communication, we must be educated. Most of us consider communication as someone speaking. The spoken word is only part of communication. As a matter of fact, nonverbal communication speaks louder than words. Rushing around the room as though there's no time for the patient, walking away when the patient is still speaking, talking, tapping your foot, crossing your arms, those are all negative nonverbal communication methods. Why is this important? Well, first of all, it is wrong to treat anyone in that manner. Secondly, this behavior decreases patient satisfaction, which can affect the hospital financially. Higher patient satisfaction scores reduce the risk of malpractice lawsuits and increase profitability. Again, they are our customers and they have a choice. Lastly, higher scores have been shown to improve patients' health and their health outcomes, as well as their involvement in their own treatment plan. The problem, however, is not just with the staff. It also includes leadership on this unit. There's a culture of negativity on the unit. The nurse manager has the second lowest associate satisfaction rating per the Glint survey that is performed quarterly in the entire facility. Her scores have been that way for over a year. She is aggressive in her demeanor and in her communication style. She is on an action plan and has been for quite some time, but the scores have not improved. Why? Maybe some of it can be attributed to personality, but education is the real key. How can we hold our team accountable if they've not been properly trained? How can the nurse manager be successful if not taught? This is the proposal. We will provide formal customer service focused education to all staff on the rehabilitation unit. The unit leader has reached out to our partner, La Berge Casino. They have a professional trainer who teaches class approximately 3 hours long to all employees hired at the casino. Has anyone experienced a rude employee at the casino? A bad experience, other than losing money at the slots? I know I haven't. This training will be free of charge. La Berge is donating it. They are a community business partner, and that is why. The main cost associated with this proposal will be the training time. It is not possible to do it during a scheduled shift due to the length of the class, again, approximately 3 hours. There are 29 nurses, aides, physical, speech, and occupational therapists that require training. I expect a minimum of 90 hours of overtime will be paid to complete the training process. In addition, there are 11 PRN associates who will need to be trained as well. They will not be paid overtime, however, that's approximately another 33 hours of pay. The class is tentatively scheduled to start on December the 6th. I expect it to take most of the month, having 2 sessions per week to train the entire staff, including the PRN associates. The only other expected cost from this proposal will be the rewards the staff receive for achieving our goal, and I will discuss that later. In order for the staff's perception of the negative feeling on the unit to change after everyone is trained, a short survey will be given to the class, before and after the class. The post-class poll will be taken 3 months after the class completes to allow time for behaviors to change. The survey will be a brief questionnaire with 3 questions. Number 1, do you believe that your leader speaks to you in a positive manner? Number 2, do staff members speak respectfully to each other? And number 3, does the unit feel like a positive place to work? The questions are very subjective, but I believe after completion of training, the answers to these questions will be an improvement over the pre-training survey results. As we all know, it takes time to change the behaviors and cultures of a unit. However, it is reasonable to project a steady increase in the patient satisfaction scores beginning in January 2022. Although we receive very few formal surveys via Qualtrics, we have also instituted a survey monkey that the patients complete immediately prior to discharge. Although the Qualtrics scores are the ones that count, the SurveyMonkey can show any trends that may need to be addressed. In addition, the next survey to rate the nurse manager will be in January of 2022. However, once again, that is not enough time for practices to have changed entirely. Therefore, I project that the nurse manager's associate satisfaction scores will improve by 10% with the March 2022 survey. Once again, all due to the customer service focused communication class. Finally, what will motivate the staff to change their poor communication? Obviously, there's a punitive route, and certainly there will be coaching. However, I propose to make them a challenge. If, after completing training, every month we meet or exceed our goal of 74%, the staff is rewarded. This can be providing a lunch, maybe a gift card, a voucher to the gift shop, recognition throughout the hospital, perhaps an overhead announcement. These costs are minimal compared to the return we will get. As they continue to meet the goal, we increase the goal. So now the goal is 74%. When they consistently meet that, then we increase it to 78%, and then so on. Part of our mission statement is to extend the healing ministry of Jesus Christ. Another method to gauge the outcome of our customer service focused communication would be to place a pre-printed index card in the patient's room. On the card, there would be a space for an employee's name, and after that, it would say, blank, extended the healing ministry of Jesus Christ to me. The patient will be able to write the staff member's name in there, sign it, and turn it in. The team member with the most cards in a month is recognized and gets an award. The evaluation to discover if this proposal is successful is one that is already in place. Our Qualtrics scores patient satisfaction will improve. Their SurveyMonkey results will improve, or at least will show trends of where we need to work. Again, these results will not happen immediately. I project the scores to begin to increase in January of 2022. Our patients are our customers. They have a choice. We must do everything possible to ensure they always choose us. The quality improvement proposal will help ensure that after they choose us, they leave our hospital knowing we not only say our core values are dignity, integrity, compassion, excellence, and stewardship, but that we live it. Thank you.